Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, founder of Migraine Nation and chronic daily migraine survivor. I'm excited to tell you that I am here today with Dr. Susan Hutchinson. Dr. Hutchinson is a headache specialist and the founder of the Orange County Migraine and Headache Center. She has authored a book called The Women's Guide to Managing Migraine. Hello, Dr. Hutchinson. How are you?
Hi, good morning, Lindsay. It's a pleasure to be here, and it's a pleasure to be talking on this topic that's so near and dear to my heart.
I am excited to have you here, and I was planning on having your book to show everyone, and I don't have it right here. I'm really excited to discuss this topic with you. You are so knowledgeable in this area, so let me just tell everyone that today our topic is the estrogen controversy, the estrogen and migraine controversy. This is a big, big topic to take on, and you are just a great person to have on for this. So let's just ask everyone out there, has anyone ever been told that you can't take estrogen containing birth control pills or any other form of estrogen because you experience migraine with aura, and there's an increased risk of stroke? This is part of what we're going to tackle today. We're going to tackle this topic. Dr. Hutchinson is an expert in this area. She is very used to speaking on this topic. And so we really want to talk about this because a lot of us, even if we have migraine with aura, we might have reasons that we really want to take estrogen containing birth control pills, etc. And we really might want to talk that through in more depth with our healthcare provider and say, hey, why? Is there a really good reason, et cetera, et cetera. So let's talk to Dr. Hutchinson about this. So let's begin by elucidating for everyone what the controversy is that we're referring to here. What is the danger for those of us who have migraine with aura and want to take estrogen containing birth control pills or estrogen in general?
That's a great question. The primary concern is that women under 45 years old that have migraine with aura, they are at least a twofold increased risk of ischemic stroke, a type of stroke compared to women that have migraine without aura and compared to the general population. And so the concern is if we add an estrogen containing form of contraception, we're further increasing that risk. So that's why some of the leading organizations like the World Health Organization, American College of OBGYN, they're pretty adamant in their guidelines about not using estrogen-containing contraception in women that have migraine with aura. Okay. As you know, Lindsay, I disagree on that. And even if we look at the society that I'm part of, American Headache Society, it's been a number of years, but they actually have a statement stating that we could consider estrogen in women that have migraine with simple aura.
Okay. So let's go back a little bit so that women understand, because that can be scary depending on your personality, your experience, etc. It can be scary to hear that you could have a twofold increased risk of stroke, etc. So historically, these studies that found that those of us with migraine with aura, had this increased risk. Were they on a high level of estrogen? These studies that first looked at this, were they on a level of estrogen that's like what we would be on today? What was that? What did those studies look like?
Oh, that's a great question, because I get upset, and I think many of us do in the headache world, that many of these statements about not using estrogen-containing contraception in women that have migraine with aura were based on these much higher ethinyl estradiol, that's the estrogen in most oral birth control pills. It was anywhere from 35 to 80 micrograms of ethinyl estradiol. And now we have multiple preparations that have only 10, 13, 15, 20, 25. So I think we need new studies. And I know they're starting to come out showing that the risk of ischemic stroke is really related to the amount of estrogen in the oral contraceptive preparation, or in some cases in something like a vaginal ring, like the NuvaRing.
Okay. So you have historically made the point that an individualized approach is needed when it comes to considering the use of estrogen in women who have migraine with aura. Is this correct? In other words, you can't just blanket say, okay, if you have migraine with aura, get out of my office. We're not giving you estrogen.
Oh, I completely agree, because you have to look at other risk factors, right? I mean, you know, migraine is an independent risk factor, more so if it's a migraine with aura. And that's about 30%, by the way, of individuals with migraine that have aura. But we need to look at things like that particular woman in front of me. Does she smoke? Does she have high blood pressure? Is she overweight? You know, does she have high cholesterol? What's the family history? So that's why I think it's so critical to take an individualized approach, because I think for certain women, the benefit of using an estrogen-containing contraception outweighs the risk. And, you know, Lindsay, we can't change the fact that, you know, those of us that have migraine, you know, we have migraine, and it could be with or without aura, but let's control what we can in terms of other stroke risk factors, because I think that makes it potentially safer in an individual woman to proceed with estrogen if she doesn't have other risk factors for stroke.
Right. So let's really quick go into what some of the medical conditions or issues or problems that we might have that would make us need or want estrogen or estrogen containing birth control pills, so that would make you consider us more deeply, even if we had aura. What would some of those be?
Well, quite frankly, you know, I think estrogen containing preparations are a very effective form of contraception. What's nice is there's also potentially a benefit in preventing menstrual migraine. So if you had a woman that had horrible menstrual migraine, when in a sense, when you're putting a woman on a birth control preparation, it's almost like you're putting your ovaries into sleep. The ovaries then no longer have all these ups and downs in estrogen and progesterone. So if you are put, let's say, on a monophasic, and let me define that, monophasic birth control pill would be where the amount of estrogen and progesterone are the same in every active pill. So let's say we put a woman on that, and maybe even doing it continuously so she doesn't stop and have a bleed every month. You can really make a difference in the quality of her life. You can also, as a side note, sometimes it can even help depression and emotional disorders to have that even amount. And Lindsay, there's other gynecological conditions like polycystic ovarian syndrome. There's endometriosis. There's ovarian cyst. There are a number of gynecological disorders that can actually be helped by having that woman go on an estrogen-containing form of contraception. And that's why I don't think there should be a blanket statement that if you have aura, you're not a candidate for estrogen-containing contraception.
Right. And I think that, you know, we should state that the National Headache Foundation and anyone, you have to go to your doctor and discuss these things yourself. We're not telling anyone to do this sort of thing, because we aren't your doctor, but we are stating some of the medical knowledge that Dr. Hutchinson has. And I can say, as someone that has a migraine brain, I was very sensitive to my own ups and downs in estrogen. And when I was able to stabilize it in this manner, oh my goodness, did I feel better. So I was one of these people that was listening very closely to doctors like Dr. Hutchinson, who were investigating whether every woman with aura could not have estrogen, because it was so helpful to someone like me. My next question is, let's talk about simple aura versus other types of aura, because I believe this is one of the questions that you ask patients. When you say that one of the guidelines talks about simple aura, maybe that isn't as big a problem as more complicated aura when it comes to the use of estrogen. Can you talk to us about what the difference might be, so that people might know which one they have?
Yes. And first, I think aura sometimes is overdiagnosed, sometimes it's underdiagnosed. So I think it's important for your listeners to know that by definition, aura must last 5 minutes or more. Why do I say that, Lindsay? I've had women say, oh, I have aura. And I'll say, what do you mean? Oh, I get sensitivity to light, or I get one shimmering, shiny spot in my visual field for 1 second. So first of all, I want to make sure that the aura has been diagnosed. Does the woman really have aura? The most common when I talk about simple aura would be visual. That's absolutely the most common. And I'm reassured if that visual aura lasts less than 60 minutes and typically is followed by a migraine. So typical visual aura would be sometimes women lose peripheral vision, or they see shiny spots. Or I know I had a mother say, I know my child has migraine because she says she sees fireworks when there are no fireworks. So when you see things in your visual field that others don't see, or sometimes the opposite of that, when you lose vision in part of your visual field, that would be an example of a simple visual aura. Now, simple to me, again, it must last less than 60 minutes and everything goes back to normal. Now, there's other aura symptoms as well. One, you could have slurred speech. Another, you could have numbness or tingling going down your arm or one side of your body. As long as everything completely goes back to normal in 1 hour or less, I'm comfortable with that. Now, to contrast that, an example of a complicated aura would be a person that has motor weakness, and it almost seems like a stroke, where they actually lose strength in their arm or their leg. That's different than just having numbness or tingling, and that's actually called a hemiplegic migraine. That would be more serious. Or I'll give you another example. I had a husband recently call me. He says, my wife's not making sense. She's really confused. This is more complicated than her normal aura. So I appropriately had him take her to the local emergency room just to make sure that she wasn't having a stroke. Fortunately, she wasn't. So to me, when the family member thinks that it could be a stroke and it's more than the usual aura, that's when I would call it a complicated aura. And certainly if it lasts greater than 1 hour, that would be complicated.
Does it have to come before the pain phase?
No, not necessarily. That's a great question. The other thing to remember is sometimes women can have aura and it's followed by a tension type headache, or it sometimes there's no headache at all. And that's especially more common as women get older, that they'll have the aura without the headache.
Okay. So I hear often when I'm talking to people about this subject. So there's people that I talk to that are like, oh, wow. So yes, that did help. My menstrual migraines got better when I went on an estrogen containing birth control pill and I took it all the way through, et cetera. Or, there's various ways this isn't necessarily a menstrual migraine episode, but there are ways that estrogen helps these people, as you discussed. But then there's some women, and let's address these women in case they're listening, who the second they take some type of estrogen, they get much worse migraine. What can you say to them?
Well, the most common estrogen that's in contraception, whether it be the vaginal ring, the oral birth control pill, is synthetic. It's called ethinyl estradiol. So it's not the same as our own ovaries produce, the most important of which is estradiol. So I find in my practice, Lindsay, there are a small number of women, they don't do well with any synthetic estrogen preparation. But it's very important. If I have a woman say, I'm doing worse since you put me on the birth control pill, I really need to know, is it when she's on the active pill or is it when she's on the placebo? Because years ago, birth control pill preparations were 21-7, meaning 21 active pills, 7 placebo. And I think sometimes women were inappropriately taken off the pill because what they were having was increased migraine during the placebo week.
Yes. So if you take those placebos, sometimes that drop in estrogen, right, can cause a migraine. And so that happens oftentimes to women that week when you're getting your period, when you take the pills, you might feel so much worse, which is why what Dr. Hutchinson was talking about, a lot of women take just active pills all the time to avoid that. But then, as she was saying, there's some women that just can't tolerate the ethinyl estradiol. So if what we're talking about, this whole thing where estrogen should make you feel better, makes no sense to you, that's okay. You are not alone. Some women, that's just the way it is. So this is a question I get all the time, and it could possibly be because of where I live. Different states seem to have different trends. And where I live, we have a lot of women that go to compounding pharmacies and have estrogen preparations made for them. And oftentimes the word used for this is bioidentical hormone therapy. Now, a lot of times people ask, is this really different than taking the estrogen that the regular pharmacist gives to you? I'd love to hear what you have to say about this.
Yes, first of all, I want to kind of define, in my opinion, what bioidentical is, because sometimes that word gets thrown around.
Right.
Bioidentical simply means it's the same estrogen, it's the same molecular compound as your own ovaries produce. So an example that I often prescribe is called the estradiol patch, because again, it's not ethinyl estradiol, which is synthetic. It's bioidentical to what your own ovaries produce. Now, you have to be careful, because when you go to compounding pharmacies, it's almost like buyer beware. So I think it's very important to understand that particular pharmacy, what their reputation is. And the other big misconception is that to get bioidentical, you have to go to a compounding pharmacy. That's just not true. There are pharmaceutical products. And again, I mentioned the estradiol patch because I use it a lot. That's made by a pharmaceutical company. And yet it is bioidentical because what it has in it is estradiol.
Okay. So another question, and there's so few people that like to prescribe hormones to women. I'm always looking for people to send these people to when they show up with these questions. People are always asking, is the dose the same? So does it mean the same if you take 10 micrograms of ethinyl estradiol as if you're taking 10 micrograms of the bioidentical estradiol?
No, it's not equivalent. And first of all, in birth control preparations, the amount of ethinyl estradiol, it's what we call supraphysiologic. It has to be greater than what your own ovaries produce, because remember, you're kind of shutting them down in a sense. You're putting your ovaries to sleep because you're trying to block ovulation. If I prescribe, on the other hand, estradiol, and usually the patches come anywhere from 0.025 to 0.1 milligrams. And sometimes you have to be careful too when you look at milligrams versus micrograms. But the point is, when we add an estrogen patch, we're simply adding a layer to what the woman's already, her own ovaries are still producing. So typically when you do hormone replacement, or what's called hormone therapy with bioidentical, you're not shutting the ovaries down. You're simply adding a layer of estrogen, which can be quite helpful in many cases. And I'll give you a quick example. Let's say, going back to your example, let's say I have a woman that anything I do with synthetic estrogen and birth control pills, she just can't tolerate it. It just doesn't work. What I might do in that woman is do an add back estradiol patch, 0.1 milligram during her period. So then, even though there's a little bit of a drop, it's almost like, think about jumping out of a seventh floor building. And if you're not on the estrogen patch as add back, you plop to the sidewalk and hurt yourself. If you're on the patch, it's almost like you fall down into this wonderful big mattress, this cushion. So what we're trying to do when I do add back hormone therapy is kind of cushion that drop in estrogen when a woman has her period.
Okay, so you mentioned earlier that the risk of stroke seemed to be mostly in women under the age of 45. For anyone over the age of 45 listening, are there any concerns for us? Because we could be entering a stage of life, perimenopause, et cetera, where we might want to go on hormone replacement therapy. So there could be things that we're considering too. Do we need to be concerned if we have migraine with aura?
Well, certainly, I think we all do. It's just that subset of women under 45 is particularly at higher risk. We have to watch them more carefully. But all of us, as we get older, age alone can be a risk factor for stroke, with or without migraine. And I can't emphasize enough the importance of being screened and having good health habits. So there's where, again, hopefully, if you're over 45 and you're getting older, hopefully you're doing more than just your well woman exam, your pap smear, your mammogram. Hopefully you're also getting more of what I call an internal medicine physical. It may or may not be able to be done by your OBGYN, but what I'm thinking is blood work. We all need to know as we get older, what is our cholesterol? Right. What is our blood sugar? Are we at risk of borderline diabetes? Are we overweight? Are we exercising, smoking? And very important too is to always think about family history. Is there a family history of people having strokes under the age of 60? It's one thing to have, a grandmother that had a stroke when she's 85. That's a lot different than if you had a grandmother that had a stroke when she was 60. So again, there's so many things to look at when you're looking at overall stroke risk, that migraine with aura is just one of the many risk factors that we take into account.
Okay. Is there anything else you'd like to add to our discussion of estrogen and migraine today?
I would just like to add that I think the more educated you are as a listener, then when you go into your healthcare provider, you can be more prepared to ask the right questions.
Mhm.
And for older women that have questions about hormones, there is a good website I like called menopause.org.
Oh,
It
okay.
is the official policy statement of the North American Menopause Society, and explains a lot about what we talked about with the estradiol patch versus some of the other synthetic preparations like Premarin, because that is important because many women, when they hit perimenopause, which is where things start changing,
Mhm.
there often is an increase in migraine. And so that can be a very vulnerable time. And so
Right.
I just think that's a good educational website.
Great. All right. Well, thank you so much, Dr. Hutchinson, for being with us today. And everyone, remember that Dr. Hutchinson's book is called The Woman's Guide to Managing Migraine. It's a very interesting book. Go and look it up. So thank you so much for being with us today. And everyone, please join us again next week for the weekly webcast and podcast of the National Headache Foundation.